diabetes, the causes, symptoms and the absolute best ways to deal with it. It is estimated that 415 million people are living with diabetes in the world, which is estimated to be 1 in 11 of the world's adult population. 46% of people with diabetes are undiagnosed. The figure is expected to rise to 642 million people living with diabetes worldwide by 2040. Did you know that as of 2015, 30.3 million people in the United States, or 9.4% of the population, had diabetes? More than 1 in 4 of them didn't know they had the disease. Diabetes affects 1 in 4 people over the age of 65. About 90 to 95% of cases in adults are type 2 diabetes. First of all, what is diabetes? Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. Sometimes your body doesn't make enough, or any, insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause health problems. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy. Sometimes people call diabetes a touch of sugar or borderline diabetes. These terms suggest that someone doesn't really have diabetes or has a less serious case, but every case of diabetes is serious. Let's talk about the different types of diabetes. The most common types of diabetes are type 1, type 2, and gestational diabetes. Let's start with type 1 diabetes. If you have type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. What about type 2 diabetes? If you have type 2 diabetes, your body does not make or use insulin well. You can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs most often in middle-aged and older people. Type 2 is the most common type of diabetes. The third type is gestational diabetes. Gestational diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you've had gestational diabetes, you have a greater chance of developing type 2 diabetes later in life. Sometimes diabetes diagnosed during pregnancy is actually type 2 diabetes. Other types of diabetes but less common types include monogenic diabetes, which is an inherited form of diabetes, and cystic fibrosis-related diabetes. What are the causes of diabetes? To understand diabetes, first, you must understand how glucose is normally processed in the body. How does insulin work? Insulin is a hormone that comes from a gland situated behind and below the stomach, pancreas. The pancreas secretes insulin into the bloodstream. The insulin circulates, enabling sugar to enter your cells. Insulin lowers the amount of sugar in your bloodstream. As your blood sugar level drops, so does the secretion of insulin from your pancreas. The role of glucose, a sugar, is a source of energy for the cells that make up muscles and other tissues. Glucose comes from 2 major sources, food and your liver. Sugar is absorbed into the bloodstream, where it enters cells with the help of insulin. Your liver stores and makes glucose. When your glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogen into glucose to keep your glucose level within a normal range. What are actually the symptoms of diabetes? Diabetes symptoms vary depending on how much your blood sugar is elevated. Some people, especially those with prediabetes or type 2 diabetes, may not experience symptoms initially. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the signs and symptoms of type 1 and type 2 diabetes are increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. Fatigue, irritability, blurred vision, slow healing sores, frequent infections, such as gums or skin infections and vaginal infections. Well, what health problems can people with diabetes develop? Over time, high blood glucose leads to problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, and foot problems. What about risk factors or the triggers of diabetes? Risk factors for diabetes depend on the type of diabetes. Although the exact cause of type 1 diabetes is unknown, factors that may signal an increased risk include: Number 1. Family history. Your risk increases if a parent or sibling has type 1 diabetes. Number 2. Environmental factors. Circumstances such as exposure to a viral illness likely play some role in type 1 diabetes. Number 3. The presence of damaging immune system cells, autoantibodies. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes. But not everyone who has these autoantibodies develops diabetes. Number 4. Geography. Certain countries, such as Finland and Sweden, have higher rates of type 1 diabetes. Number 5. Weight. The more fatty tissue you have, the more resistant your cells become to insulin. Number 6. Inactivity. The less active you are, the greater your risk. Physical activity helps you control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. Number 7. Race. Although it's unclear why, people of certain races, including Black people, Hispanics, American Indians, and Asian Americans, are at higher risk. Number 8. Age. Your risk increases as you get older. This may be because you tend to exercise less, lose muscle mass, and gain weight as you age. How do you prevent yourself from getting diabetes? Well, type 1 diabetes can't be prevented. However, the same healthy lifestyle choices that help treat prediabetes, type 2 diabetes, and gestational diabetes can also help prevent them. Eat healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grains. Strive for variety to prevent boredom. Get more physical activity. Aim for 30 minutes of moderate physical activity a day. Take a brisk daily walk. Ride your bike, swim laps. If you can't fit in a long workout, break it up into smaller sessions spread throughout the day. Lose excess pounds. If you're overweight, losing even 7% of your body weight, for example, 14 pounds, 6.4 kilograms, if you weigh 200 pounds, 90.7 kilograms, can reduce the risk of diabetes. Don't try to lose weight during pregnancy, however. Talk to your doctor about how much weight is healthy for you to gain during pregnancy. To keep your weight in a healthy range, focus on permanent changes to your eating and exercise habits. Motivate yourself by remembering the benefits of losing weight, such as a healthier heart, more energy, and improved self-esteem. When should you go see a doctor? Well, if you suspect you or your child may have diabetes. If you notice any possible diabetes symptoms, contact your doctor. The earlier the condition is diagnosed, the sooner treatment can begin. If you've already been diagnosed with diabetes, after you receive your diagnosis, you'll need close medical follow-up until your blood sugar levels stabilize. Thank you for listening. In this channel, we will cover all health issues and questions and solutions you often ask yourself, but rarely find the right answer to. Our goal is to empower the healthy version of you. So subscribe, share, and see you in a few days.